Hello. We will present our research on promising technologies to support human activities in confined space in the industry. We are researchers at the XR for Good Laboratory, and we are part of the graduate program in Instrumentation, Control and Automation of Mining Process at the Federal University of Ouro Preto and at the Vale Technology Institute. Although there is a growing concern about accidents at work, global statistics still reveal alarming data. It is estimated that 2.78 million people die each year in the world due to labor factors. In this regard, information and industrial automation systems applying to occupational health and safety are gaining prominence for accident prevention. Only high-risk activity that has adopted technology as an ICEIS work in confined space. Tasks in these locations can cause several accidents and worker deaths. Nowadays, robotic systems has been widely adopted to replace the entry of workers in these places. However, these solutions do not cover all scenarios and still require humans to perform activities in the confined spaces, because these are environments with divergent operational parameters. Autonomous solutions for these sites are limited to certain tasks such as cleaning, inspection, and maintenance. Thus, due to the high cost of developing specific systems, technologies such as wearable computing, virtual reality, and augmented reality are expected to assist humans in these locations so that the worker stays as little time as possible in the confined space. Currently, the main contributions of the IoT technologies are geared toward improving the flow of information between people and toward improving gas measuring and monitoring processes, largely done by portable meters. The problem regarding the use of this equipment in confined space is that it requires some efforts to achieve its full potential. Moreover, when using them, the operator loses some of his mobility, not being able to work off his hands completely free in some cases. This interaction with the portable meters is, to some extent, a poor way of integrating computer system and not the most ideal for this type of operation. In the coming years, it is expected that gas monitoring in these places will be carried out by wearable computers attached to workers' personal protection equipment, PPE. Since the gases found in these environments have different densities, the distribution of sensors over the worker's body can allow more assertive measurements. In addition, wearables on PPE will allow monitoring of employees' vital signs to assist in detection of oxygen insufficiency on site, for example. This way of monitoring will enable direct and instant access to information for the work safety teams. The use of augmented reality, AR, in confined space will also bring greater efficiency and safety for the confined worker. Equipped with smart glasses, employees will be able to access the information collected by the sensor in the confined space in a simple and intuitive way, without having to handle the measured equipment. Augmented reality will also enable remote collaboration between confined and non-confined workers. Integrating video cameras will process computer vision algorithms to assist in environment measurement, identification, and recognition tasks. Regarding robots in confined space, studies also foresee humanoid robots transiting confined space. Some researchers have already carried out relevant work in this area. Finally, the fact that most confined spaces are classified as potentially explosive atmospheres is weighed against the adoption of these technologies on an industrial scale. The high cost of these technologies are also barriers to adoption of this equipment. As future work plan to develop AR devices that computationally color concentrations of naturally colorless gases in AR glasses. We thank you for your attention and invite you to follow our research on the Art for Good Laboratory.